Hello and welcome to another exciting edition of the program Health Affair on AIT. It is a program where we discuss critical health issues with a view to finding lasting solutions. I am your host, Oshomowa Daniels. On the show today, we shall be discussing about Nigeria's health sector, the impact of the COVID-19 pandemic, and strategies for health system recovery. But before then, let's take you to our news segment for some reports.
Members of the Nigerian Dental Association have joined other Nigerians to call for justice and an end to the killing of peaceful protesters and destruction of properties.
It is with sadness that I received the reports of vandalization and looting of dental clinics, among many other business facilities of citizens in Lagos. I call on all relevant authorities to take urgent steps to stem this ugly trend. I call on the government to bring solace and consolation by offering compensations to members and victims of this situation.
Destruction of property, violence, and killings have become the story of a peaceful protest by Nigerian youths, which started over 2 weeks ago, to demand an end to police brutality and bad governance.
We stand in solidarity with all well-meaning Nigerians in their demand for better policing and improved quality of life. We also urge the government at all levels to seek better ways and means of interfacing with the genuine protesters.
The situation took a different twist in Lagos on Tuesday, 20th of October, when some unidentified armed men opened fire on some peaceful protesters at the Lekki toll gate. Nigerian doctors have called for focused planning and actions to address the poor health indices in Nigeria, which has been made worse by the COVID-19 pandemic. The doctors made this call at the 2020 Physicians Week in Lagos, Nigeria. To ensure recovery of health system amid the COVID-19 pandemic, they suggested a 6 core components approach which focuses on service delivery, the health workforce, health information system, improving access to essential medicines, and paying more attention to healthcare financing. The Physician Week is an annual event by the Nigerian Medical Association to celebrate their contribution to the nation's health sector and review the sector's performance in the past months.
Breast cancer incidence, according to medical experts, has been rising steadily in the last few years, especially in low-income countries like Nigeria. There is currently an estimated 36,310 cases of cancer per annum in Nigeria. It is to reduce this burden on women that the Nigerian Army 9th Brigade provided an intervention for about 300 women to mark the 2020 Breast Cancer Awareness Day in Lagos.
This is an opportunity because it's better to check, to know, and to treat. So knowing about it is key. So women should come out and take advantage of this program and enjoy the benefit, because this program is coming to us on our doorsteps. We don't have to go looking for them or looking for where to check. So I think to know about it, to check first, know about it and treat it is very, very important.
There are WHO recommended procedures for women. Women are advised to have the monthly self-breast examination where you're taught to know your breasts. You're going to be able to feel changes earlier enough, be able to notice any slight changes in your breast. The other recommended procedure is the mammography. Mammography is recommended for women who are above 40. Then for women, younger women who are below 40, the ultrasound scan, the sonomammography is what is recommended to ensure that there is early detection. Early detection, they say, is key. There are no known causes of breast cancer. However, there are risk factors which predisposes women to breast cancer. Age, they are modifiable and they're not modifiable. The non-modifiables like age, you can't modify age, your gender, female. Then the modifiable ones are things like smoking, alcohol intake, and healthy diets. Diets that is rich in fruits and vegetables are the key things to use to prevent breast cancer.
To improve care is awareness. Number one, you need to know what is wrong with you before you can talk of care. So a lot of people don't have the awareness. They're even scared to come out. So I want to appeal to them to take advantage of screening, know what is wrong with you, at least know your body, especially women, know your body, because cervical cancer is very silent in women. So we want to avoid the untimely death in it, the mortality rate in it.
Some of the beneficiaries who spoke with AIT said the intervention was timely.
I'm happy that I am a participant and I received some information that will help me also to pass across to some of my friends and colleagues.
The theme for the 2020 Cancer Awareness Campaign is "We Fight, We Win." Welcome back. The scaring statistics of health indicators in the country, which has further worsened with the COVID-19 pandemic, for Nigerian doctors is unacceptable, as no meaningful development can happen in a society where diseases and deaths are ravaging the potential leaders. With me on the show to discuss this topic today is the president of Nigerian Medical Association, Dr. Innocent Uja.
COVID-19 came to expose us to the weak health system. We need to strengthen our health system, not just during the COVID-19 pandemic, but even post COVID-19 pandemic, because we do not know how long we are going to be battling with COVID-19. You all know that the number of doctors in Nigeria are fewer than the population we have. The doctor-patient ratio is 1 to 5,000 or more in some places because it's not evenly distributed, unlike the WHO recommendation of 1 to 600. Now, even as inadequate as the number, many of our doctors are leaving this country. And why are they leaving this country? That is where we will have to reflect and concentrate also. Why are they leaving this country? Well, they're leaving this country for many reasons. One, the environment, the work environment is very, very harsh. Two, the facilities that will facilitate the use of their knowledge and experience are not there. The equipment are not there at all. Just look at the issue of PPE, personal protective equipment. They're not there many of the time because we fail to plan. And that is why, unfortunately, the resident doctors had to go on strike before personal protective equipment were given. Because it's a risk factor. If you don't use personal protective equipment, you would run the risk of having the disease. And you know that many of our doctors, over 321 people, contacted the disease, and we lost 16 in the service of giving life to our people. And that is not acceptable anywhere. Doctors are not properly paid, and that is a frank truth. The doctors we produce in Nigeria are of high quality, and that's why they are sought after in the whole world. Anywhere they go, they will be accepted, and they make their marks. So if that is so, why are we not being appreciated in Nigeria? Doctors need to be paid properly. The hazard allowance of 5,000 naira a month, I mean, it's an insult. The other thing is that the hospital facilities are not conducive. The hospital facilities are not conducive. The equipments are not there. And you find that many of the hospitals are severely dilapidated. If we are talking about federal government hospital, then go to the states. The states are worse off. The primary healthcare system has collapsed. You go to anywhere now, they're just places where they put livestock, hospital facilities, livestock, or harvested maize or rice. And that is an insult. We need, it's not the number of buildings, it's what is inside. Equipment, capacity, doctors, nurses, midwives, the primary healthcare facility. So they are not there. People, that's the weak health system. And if you look at this, even at this national health emergency, the global health emergency, where the federal government was doing its best to ensure that they contain the pandemic, some states were not bothered, and they say that they don't have COVID. I mean, how could epidemiologically we know that no state is an island of its own? What happens to A will likely happen to B, but the magnitude may be different. Just like Lagos, Lagos being the epicenter, Lagos is the commercial hub center of Nigeria, and international movements are very many. So you expect many more people to come through Lagos, and that is why we had a large number of cases from Lagos. But Lagos State was prepared to some extent. When you compare all the states, Lagos State is far, far ahead of them because of the commitment of the governor and the commitment of health workers and the effective coordination by the Commissioner of Health. So you find that even in this country, we are segmented.
What do you think we can do to stabilize the health system?
There should be what we call peer review mechanism. If a state is doing well, the other states should copy. It's not an issue of ego tripping. It's not. And it's not a competition. We should be able to see how we respond appropriately. We are growing exponentially. We are not controlling our population. And common diseases like communicable diseases and non-communicable diseases are emerging. So we need to be prepared. The private sector must come in. The private sector must come in. We can't leave it to the government alone. And in doing so, we believe that one of the ways that will help the governments and the people of Nigeria is for the federal government to establish a health bank or bank for health. If we have bank for industry and we have bank for agriculture, why can we not have bank for health? And the reality is that if you go to India, the facilities they have, the hospitals and clinics they have that Nigeria are trooped to, they are not government facilities, they are private facilities. And what government did was to create an enabling environment, ensure that there is a decrease, it is low interest rate, single digit interest rate for private sector participation, so that they can build state-of-the-art hospitals with a consortium of experts. And then they have well-equipped hospitals, modern equipment. You cannot do without modern equipment. So we need to do that. If the government does that and look at the 100 billion, no doctor in Nigeria has gotten it. 100 billion. Then who is getting it? The doctor is at the forefront. The doctor is the leader of the health team. So things are not just right. And if we want to improve the health of Nigerians, private sector participation is very important. It's not enough to be waiting for donor contribution to health. No, they can still do that. But the strategic option, in our opinion, is that we should develop a health bank so that you have low interest rate and then you build beautiful specialized hospitals. If you want to go to an eye hospital in Abuja or Lagos, or go to your Port Harcourt, or you have urological problems, you know where to go. In that case, those who are running out for medical, spending our foreign exchange will stay back. Because if you go to Europe and America, you find that many of the people who are treating you are from Nigeria. The experts are there from Nigeria. So why do you want to go to Sokoto? What you have is in Sokoto. In that case, I believe that we will improve the health system in Nigeria.
So do you see the possibility of a second wave of the pandemic, and what's the advice to Nigerians?
If we are talking about the likelihood of second wave of the pandemic, then we must start preparing. In fact, we would have been prepared. It's not an issue when it comes, or then we should be running helter-skelter. So it is possible, and we pray that it doesn't come. Because if it comes, we will be finished. Because of the weak health system we have. To answer your question very specifically, I would say that it is likely that it will come. And therefore, we should be prepared. If we prepare and it doesn't come, then we will not have lost anything.
So much has been said. What's your take-home message in all of this about improving the sector, people's attitude to prevent more diseases and all that?
Well, I think the first thing is commitment, political commitment of governments. Each time I talk about governments, because each time anything happens, they believe that it's federal government. No, the governors are elected and they had their own manifesto. Local government, they were elected and they have their manifesto. So they must collect, they must work together, they must come together so that we will be able to respond appropriately. Attitude of Nigerians. Nigerians must believe in experts because the president himself said he must respect and listen to the experts. But Nigerians, because of the high level of illiteracy, people do not know the value of the experts. The National Retention Agency must continually do its work because they need to provide information, they need to educate. And it's only when they do that we can improve our attitude and our behavior. We can change the orientation of the individuals, of the people. When we talk about national response, we forget about research. Research, look at what Lagos is doing. Lagos brings out data. In fact, at one point, they mapped the whole of Lagos State. And they now focused where they now identified where the largest number of cases were coming from. And they developed probably different messages to contain, to help. They focused more on the areas where there were very many, instead of just scattering one's effort. They were able to map the Lagos by local government, even Lagos government, they mapped the communities. That is what research does. Finally, we want to thank God for ensuring that not many more Nigerians are dying from COVID. And we must have what we call universal precaution, infection prevention and control, regular hand washing, not just for COVID, but for any situation that we have. And also for COVID, in addition, we need to have face masks and social distancing.
Thank you, Dr. Uja, for coming on the show. Please don't go away. We'll be right back after this break.
A healthy population, people often say, builds a prosperous nation. But many Nigerians are threatened on a daily basis and die needlessly due to diseases, poor health care, malnutrition, and lack of access to relevant information. The sorry state of our health infrastructure has also been a major challenge. On Health Affair, Oshomoa Daniels brings these challenges to the attention of relevant authorities for a lasting solution. For sponsorship and advert placements, please call the numbers showing on your screen. Health Affair, your access to good health through quality information.
It is time for our nutrition segment, an aspect of the show where we promote the idea of eating right to stay healthy. Our focus today is on beans and its nutritional benefits. Beans are the seeds of one of the several genera of flowery plant family, Fabaceae, which are used as vegetables for human or animal food. They can be cooked in many different ways, including boiling, frying, and baking. Beans are used in several traditional dishes throughout the world. They are mature forms of legume seeds, a simple dry fruit which is contained within a pod and comes in different varieties. Beans are a summer crop that needs warm temperature to grow and matures between 55 to 60 days from planting to harvest. Beans are one of the earliest cultivated plants, with proof of cultivation and being used as food dated back to about 9,000 years ago. It was domesticated in Thailand, although African countries like Nigeria and Tanzania are also part of the world's largest producers of beans. They were known to ancient Egypt as they were left as food in the tombs of dead kings to be eaten in the afterlife. Beans was also known as the food given to Daniel when he lived in captivity for 70 years at Babylon in ancient Assyria in 605 BC. Beans are valued worldwide as a sustainable and inexpensive meat alternative and are considered as the second most important food source after cereal. They are nutritionally valuable as 100-gram serving provides 347 calories of energy, 42% of protein with essential amino acids, 64% carbohydrates, including dietary fiber. They have no cholesterol and are generally low in fat, which is about 1%. Beans also provide essential minerals and vitamins like potassium, 39%, magnesium, 44%, iron, 28%, calcium, 11%, vitamin B6, also known as folate, 25%, and 10% vitamin C. Beans contain some bioactive compounds like flavonoids, polyphenols, among others, which possess antioxidant properties and play major roles in the prevention of certain cancers, heart diseases, rheumatism, osteoporosis, and other degenerative diseases. Welcome back. I hope you will make beans regular on your menu as from today. It is better to eat right to prevent unnecessary diseases. Now we'll take you to our clinic for some health tips.
Did you know that excessive use of medicine damages the liver and the kidney? There are lots of fake drugs in the market. Please buy your medicines from reputable pharmacy shops. Please, drink plenty of water, minimum of at least 2 liters of water in a day. Brush your teeth twice daily with toothbrush and toothpaste. Exercise regularly to keep fit. And please, very important, always wash your hands with soap and water.
Next on the show is our Perception Corner, a section where we listen to your opinion about the health sector and general issues that affect human lives and the way forward.
I met an old man here today. He was returned back home. If you were to go home and die there, who do you blame? Who do you blame? The government or the hospital? Too bad for this country.
We be see they chop our money. They use and they enjoy. Go abroad. Go they do medical facilities. We be say we get for Nigeria. Why be say we be the citizen of this country? No go fit enjoy inside Nigeria all year. And the media, through this medium, we be say we tell the government, we be say make they help us do better thing for our doctors and nurses. The money we be say they go they spend for abroad, let them utilize it here. Make them know they go Joro. Make them know do say they give one person money, they no give one person money. They should do the right thing. That is all what we need.
You know, a lot of hard talking from the Ministries of Labor and Employment and the Ministry of Health. I think we should desist from that. You know, there's something called negotiation in labor and industrial relations. But I've seen some of our government officials, particularly with regard to the health sector, not following that protocol. But it's that in the face of the COVID-19 pandemic, countries around the world have been defending the interests of frontline health workers, those they call the first line of defense for COVID-19. They are the ones who risk their lives, either attending to patients who may be asymptomatic. And in fact, the Nigerian Medical Association has had to say, we lost around the period over 400 doctors. And yet these are the same people who will not be given their allowances, who will not get enough protective equipment. And I think that, it's a very serious matter.
A healthy population, people often say, builds a prosperous nation. But many Nigerians are threatened on a daily basis and die needlessly due to diseases, poor health care, malnutrition, and lack of access to relevant information. The sorry state of our health infrastructure has also been a major challenge. On Health Affair, Oshomoa Daniels brings these challenges to the attention of relevant authorities for a lasting solution. For sponsorship and advert placements, please call the numbers showing on your screen. Health Affair, your access to good health through quality information.
See, Grace, you get one party birthday party where they share for Jide house. Say they come.
Me, I see they care about this corona matter. I no one come. I beg.
But I think say Koro don't disappear for Nigeria now. No, it's still very much around, you know. It's just that the number of positive cases, them they on decline. So I beg, be careful. The opening about the sector of the economy no be excuse to let down your guard. Continue to observe all the basic rules, hygiene rules to stay safe.
This is where we draw the curtain on the show today. Please keep a date with us at 9:30 a.m. on Wednesday. Please keep staying safe and pray for peace in Nigeria at this time of crisis. My name is Osho Mowa Daniels.